Good morning, everyone. I'm Adrian Dix. I'm BC's Minister of Health. I'm honored to be here on the territories of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations. It's an honor to be here on their lands. We're here today to talk about actions our government is taking to ensure diabetes patients in British Columbia do not experience a shortage of a drug called semaglutide, commonly known as Ozempic, in an environment where surging demand in some jurisdictions is driving shortages. Ozempic is a drug that will be familiar to is, of course, the subject of significant social media discussion of what may be the largest advertising campaign for a prescription drug in recent memory. If you watch a basketball game, you see Ozempic superimposed on the basketball court. If you watch a hockey game, you see it on the sideboards. If you're watching TV at all, you're seeing ads for Ozempic, both in Canada and then different ads that you would get through American affiliates received in Canada about the drug. There is a lot of hype about Ozempic. Ozempic is an injectable prescription drug designed to treat type 2 diabetes and contains the active ingredient semaglutide. This isn't the first time, of course, we've been hearing about Ozempic. In January this year, I announced the expansion of coverage for the drug to more people, as long as they obviously meet criteria. It's essentially what we call a second-line treatment covered by pharmacare for patients with type 2 diabetes. At that time, I expressed concern and provided you with information about the number of dispenses of Ozempic, the share of dispenses of Ozempic that go to the US market. At the time, it was around 9% of dispenses in British Columbia at that time. Just to put that in context, the average drug across prescription drugs in BC, the number is 0.4%, so 9% is essentially 20 times or 22 times that. So today, I asked at that time that we review and have surveillance whether those numbers change, what the impact of the ongoing interest in Ozempic in the community would have on those dispenses to the United States. I felt and strongly felt the reason I raised it at the time of expanding pharmacare coverage was to say that this was an issue and this is one that we would be reviewing and, if necessary, taking action on. And today I'm announcing that it is necessary to take some action to ensure that patients in British Columbia get access and continue to have access to Ozempic. We've also been working closely with the drug manufacturer to make sure that patients in British Columbia get access to this drug. What our data shows for January, February is the following. With respect to the dispenses of Ozempic in British Columbia purchased by US residents from pharmacies located in British Columbia, generally dispensed by mail and ordered over the internet. Just to give you an idea, for the months of January and February, 15% or 15,798 of all the Ozempic dispenses in British Columbia were sold to US residents. And 19% of the 12,816 patients who received the drug by a pharmacy were American residents. Again, this is compared to the typical average of less than 0.5% or 0.4%. As we looked at the numbers further, we found that 15 of the 15,798 dispenses for US residents, 13,197 of them were issued at only 2 BC pharmacies. This represents 88% of the total dispenses to US residents for the months of January and February. We also know that 95% of all the prescriptions for Ozempic issued to US residents were by one or more prescribers who identify themselves as a practitioner in the province of Nova Scotia. This is concerning, and in my view, it has to stop. The purpose of procuring the Ozempic for British Columbia patients is not to turn around and export it right back to the United States. The purpose of procuring Ozempic is to make sure patients in British Columbia and Canada can continue to access it. In BC, as I noted, we provide limited coverage for Ozempic under pharmacare as a second-line therapy for type 2 diabetes patients to help manage blood sugar levels when other drugs are not effective. This medication was created and intended to treat type 2 diabetes, and it is not right now an on-label drug for weight loss, although there is another drug, a sister drug, that's in that category. Recently, obviously, as you know, it has gained a lot of popularity on social media as a medication for weight loss, which is one of its side effects. The drug's popularity on social media and the, I think, almost unprecedented campaign of advertising for the drug is driving a surge in demand and is resulting in shortages of Ozempic, not yet in British Columbia, but in other jurisdictions, including the United States. Currently, we don't have a shortage of Ozempic, but the trend is in that direction, and action is required. On March 18, 2023, Drug Shortages Canada, the website for reporting drug shortages and discontinuations in Canada, indicated a national survey shortage of one formulation or one format of Ozempic. To act against shortages of Ozempic for BC patients, I have ordered the following immediate actions. I'm directing the expedited amendment of the current regulation to limit the sale or dispense of Ozempic to non-Canadian residents. I'm requesting that the BC College of Pharmacists ensure that pharmacies dispensing Ozempic are complying with all clinical dispensing practices. I'm requesting that the BC College of Physicians and Surgeons ensure physicians prescribing Ozempic are complying with the approved indication of the drug and they meet all clinical practice requirements for prescribing. I'm requesting that the Nova Scotia College of Physicians and Surgeons initiate an investigation into the exceptionally high number of out-of-province prescriptions for Ozempic emanating from Nova Scotia practitioners for dispense in British Columbia, and to take action to address what I view as an unacceptable situation. I'm requesting that the Federal Minister of Health, the Honourable Jean-Yves Duclos, review the Food and Drug Regulation under the Food and Drug Act in collaboration with provincial health ministers to address the concerning number of Ozempic prescriptions emanating from practitioners in one province, and take action to ensure and to protect the supply of drugs such as Ozempic for Canadians. I trust that our federal and provincial partners will support British Columbia in looking into this very serious issue and doing what is necessary to protect the Canadian supply of the drug. Again, this is I think, for many people, and this drug, Ozempic, has real use, really significant use for many people with type 2 diabetes. And we expect demand for the drug to increase in British Columbia for those patients as the changes that we brought about in the pharmacare system would indicate, and because the drug is effective in dealing with those with type 2 diabetes. But what we need to do as well is to ensure when we see this level of demand, this increase in American demand for the Canadian drug supply, that we're going to take action to protect British Columbians and protect Canadians. That's what we expect to do today. We're going to take that action thoughtfully, as many Canadians know who travel anywhere. They know frequently it's what we need when we go to the United States or other jurisdictions to get insulin or to get another drug at times when our supply of prescription drugs runs out and we're in another jurisdiction. The intent here is not to stop Americans from getting, especially when they come to British Columbia, from getting access to drugs. So we will be both cautious and thoughtful in the development of the actions we're taking. But we need to take some action here. It does not make sense for one or a few doctors in Nova Scotia to be prescribing Ozempic to American customers, and then having that Ozempic that's here for people in British Columbia be sent to Louisiana, to be sent to Arizona, to be sent to Missouri for patients there. That simply doesn't make sense. We would never have sufficient supply of Ozempic in British Columbia to satisfy the needs of the American market. We have to protect patients here, and that's what I'm doing today. I'm happy to take your questions.
Thank you to everyone on the phone. Please press *1 to queue in for question and a follow-up. I'll be starting in the room. Justin McEvoy, CBC.
Hey, Minister. Here all week. You said there's no shortages now in BC for the drug, but is it possible that sometime this year that could be a case for British Columbians?
That's our concern. Our concern is you want to, as much as possible, take action before there's a shortage, to take action to ensure that, and that means working obviously with the pharmaceutical company, and we do that to ensure there's access here. But we've seen an increase in this period, in a period when the overall number of dispenses has gone up because we've provided more access through pharmacare to Ozempic. But the share that's going to the American market has actually increased from 9 to 15 on one measure, from 9 to 18 on another measure. If that were to continue to happen, clearly we don't have enough Ozempic in British Columbia to satisfy the American market. And so there is that concern. Drug Shortages Canada has indicated that for at least one milligram form of Ozempic that there is a shortage or a risk of shortage in Canada now. We are not seeing that yet in BC, but we're taking action to ensure that that doesn't happen.
And you said two pharmacies responsible for the vast majority of this exportation to the States. Is there anything you can say about A, the location of them, and B, have things like this happened with different drugs in the past in terms of exporting to the States, or is this something new?
This issue of Americans coming to Canada has been an American political issue for some time, right? But this is a different proposition here. What's happening here is through a particular means, and in this case, through practitioners in Nova Scotia, through the pharmacies in British Columbia and dispensing out, is really the evolution of internet pharmacy. And I think that the sheer extent of it in these cases represents a significant reach. I mean, we want people when they come to Canada to be able to access prescription drugs. Of course we do. And there have been occasions, I think I can recall, perhaps it was Senator Sanders or someone in the United States leading a delegation during an election campaign to Windsor, I think it was, or to an Ontario jurisdiction where they bought drugs, because there's a differential between drug prices in Canada and drug prices in the United States on some drugs, partly because of our public health care system. We do, and we work hard with pharmaceutical companies to negotiate the price of drugs and to work on that. Whereas that, for the American Medicare program, for a long period since the 2004 changes, has not been allowed. So there's been differentials. So this issue we've seen before, but this is what this suggests is that the increasing purchase of Ozempic in Canada, we haven't seen the top of it. The demand for the drug is significant in the United States, and that amount is going up, and we don't want to see that. We don't want to see the mass exportation of a drug that's needed by British Columbians to the United States. There's surely better answers than that, and I don't think a model where a single or group of practitioners in Nova Scotia is doing this level of prescribing, and I presume, although I don't know, that such prescribing would be based on US prescriptions, but would be doing that level of prescribing. And there are issues around clinical standards, and I have no evidence one way or another of that, but I would say that the issuing of in the tens of thousands of prescriptions over 2 months for one drug is a significant amount of work and prescribing. But that's not what the system was set up for. And so that's why we have to work. It's a national problem. It's a problem across the 10 provinces. This is a drug that's in demand. There's significant off-label use that we all know about related to weight loss. We need to take some action, and that's what we're doing.
Keith Baldry, Global.
So there's a big increase of American prescription. What about British? Since you expanded the use of this in December, has there been a noticeable uptick in British Columbians getting this drug?
There's been an increase in access that you'd expect. Like the drug wasn't previously covered under pharmacare. So obviously it's a second line drug, which means that you have to use the first line drug, which is typically metformin for type 2 diabetes and others. And then if that doesn't work, then you have access to. So there has been an increase. So when you look at the overall numbers, and we'll share those with you, the increase in percentage is on a bigger base as well. So what we're seeing over a couple of months is a small group of prescribers seemingly associated with pharmacies in BC trying to meet a demand in the American market for a drug in demand here in BC. But yes, there's an increase in demand because we've increased access through pharmacare to this drug based on the clinical evidence that we've been provided. And I think especially endocrinologists in BC and others have obviously expressed a lot of interest. There was a lot of interest in us doing that. And as you recall, I announced that early in January.
As a follow-up, sort of a technical question, someone who takes this drug, how often do they take this drug? And could some of these Americans, are they repeat customers?
Well, they would be. I mean, there's more dispenses to the United States than there are customers, right? So I think the number of customers was in the 12,000 range, the number of dispenses in the 15,000 range. But yes, this is a drug that you would use on a continuing basis. And so you would see continuing dispenses, and we can provide you the information. We typically have pharmacists provide that kind of information.
Vaughn Palmer, Vancouver Sun.
Yeah, I'm curious as to what you know so far about how this trade works. Why would Americans be buying here? Is it because it's cheaper, or because there's a shortage? And why would Nova Scotians be going through British Columbia? Is it because we have more, or there are more restrictions there than there are here?
On the first, I think it's both. Could be both a question of price, but largely a question of access. It's quite an expensive drug in general terms, and there's a lot of demand for that. And if you're watching any media, you see the hype around it, the advertising around it, but also it is a matter of a discussion in amongst others, celebrities. So you're seeing both a question of access in some American jurisdictions, so the drug not available, so this is a place to get it, and there's an issue of price. So it's both. I think this is an arrangement between prescribers and pharmacies. So I don't think there's anything necessarily particular about Nova Scotia, except that that's where the practitioners are. That's a concern for us. What we're not seeing is doctors in BC doing this. We're absolutely not seeing that. In fact, I think the doctors I talk to in BC really want to ensure that their patients have access to this drug, and you can see from the sheer numbers of prescriptions from just that the practitioner or practitioners in Nova Scotia, we're not sure which of those it is, that practitioners in BC are not doing this in any significant way. And if it was just the practitioners in BC doing it for whatever reason, that wouldn't be an issue and we wouldn't be having this press conference.
Yeah, the request to the college to review whether the rules are being enforced and who is doing it. Will you be forwarding to the college the names of these two pharmacies that account for 88%? Or will you leaving it be to the college to figure it out for itself?
Yes, we will be.
Next.
And I'd say with respect to the regulatory changes, what we want to do is really limit the ability to export a particular drug where there's a potential for a shortage. That would be the idea of the regulation we developed together.
Next question comes from Wolf Debner, Black Press.
Hi, Wolf.
Yeah, hi. Good morning. Thank you for taking my question. I'm probably not going to get the names of the two pharmacies, but can you tell me where they are in British Columbia?
Metro Vancouver.
Metro Vancouver. Okay. All right. And
their location isn't the most important thing,
understood.
because really, as I understand it, what happens is the prescription goes from the practitioner to the pharmacy, and then the pharmacy dispenses through the mail.
Right. You talked about the need to do this on a Canada-wide basis, to look at this issue at a Canada-wide basis, based on, and obviously this investigation for what you're calling that's still happening. That's still going to happen eventually, I guess. But how would you sort of rate the level of criminal enterprise or criminal energy behind the behavior that you've seen?
I think it's not a criminal matter. I mean, my expectation, we'll see what's reviewed here, is that this is a practice that is not a correct practice. But I think I don't think it would be correct to say that it's in any way to define it as criminal.
Moving to the phone. Oh, sorry. Moving to the phones, Binda Sargent, CTV.
Hi, Minister. I just wanted to ask you, is there any way to know how many of the prescriptions in British Columbia are for weight loss. I have seen some clinics advertising that you can get Ozempic through their clinic for weight loss, and I'm just wondering if the ministry is looking at those kinds of statistics.
Yeah, we look at it all. We have information on all dispenses. This is a prescription drug. All of the dispenses through the pharmacare program are for type 2 diabetes. In other words, it's not a pharmacare benefit for any purpose other than type 2 diabetes. And I would suggest that the majority of dispenses in BC are for type 2 diabetes. Remember, there's a second drug which is used for weight loss as well, which is not a listed benefit under pharmacare and not widely available. But there is a second drug in Canada. But this drug, the on-label use is for type 2 diabetes, undoubtedly, as we can tell, and because in part of the hype around the drug, and because the weight loss is a side effect of the drug, and that makes it significant. And for many people, it's something they've been considering, I suppose. That's not so. We do know in terms of dispenses how many we're covering, and we monitor it very carefully. One of the strengths of BC's system, I think, our PharmaNet system, is our historic data. It's actually extremely valuable data that the government keeps about broad issues of prescribing over a long period of time. I think PharmaNet started in 1994 or something. So we've had, and we have a fairly good way of looking not at individual cases, because obviously, but at overall dispensing of drugs. So if it's a pharmacare benefit, it's for type 2 diabetes.
Follow-up, Binder.
Yeah, I know you mentioned a couple of times about the unprecedented advertising campaign associated with Ozempic. I'm just curious if you think that maybe there is, a need to relook at how, pharmacy companies market to the public, especially when it's for something that Health Canada hasn't approved its use for.
Two things about it. First of all, the advertising is very careful, and you'll the advertising. So the advertising in Canada is essentially to put, I suppose, the drug before the public, and to essentially to do what pharmaceutical advertising tend to do, which is to ask you to talk to your healthcare provider about your doctor about a particular drug. I think this area has long been an area of discussion because what you're talking about are drugs that require a prescription to get. So what is the purpose of this level of advertising? One would need to ask. And presumably the purpose is to expand the utilization of the drug. And I think the company would argue that the drug is effective, and so that's not a bad thing. But what we're seeing in addition to that is, I think, a social media and self-propelling discussion of the drug around weight loss that has been led in a number of places. I won't name the celebrities in question, but I think you can easily find their names who have talked about using the drug as well, and that has created interest in Ozempic, in particular in the United States, but in other jurisdictions, and we're deeply connected culturally to happenings in the United States. So all of those things are a concern, but this isn't a press conference, and I'm not taking action about advertising. That's a federal government matter. I just note its existence and the hype it creates. Just wait 1 second. No, I'll just wait 1 second. I'm just waiting for the bells to stop. Thank you. And so it's not. We're not here to talk about the advertising, but the advertising is a fact. It is extensive. There was a time when you couldn't advertise prescription drugs in this way, and that's why. But we've seen obviously significant public campaigns around different drugs, and I don't need to name the ones that are the most significant in the past. Sorry.
Justin Hunter, Globe and Mail.
Oh, hi. So, Minister, are there any sanctions that are being taken or can be taken against these two pharmacies in BC? Are they just exploiting a loophole, or are they offside?
Well, I think we have to review their practices, but what I want to do is change it so this doesn't continue to happen. That's the purpose of this. I mean, it may be, I will be interested in any review of the prescribing in question, which is not an issue for the pharmacy. And obviously we'll review that. So that's not what not my greatest concern. What has happened isn't my concern. What will happen is my concern. And why I think we need to take action to ensure that people in British Columbia who need Ozempic for type 2 diabetes have access to it. So this isn't an issue of sanctions, this is an issue of changing. If there's an ability to do this, then I think this is not, in my view, in the public interest, and we have to make some changes to ensure that BC patients are protected. So I'm more interested in change and in the next 6 months than the last 6 months.
Follow up, Justin.
Yeah, thank you. And do the colleges here, or I don't know if you're aware of what the rules are in Nova Scotia, do they have effective rules in place right now to prohibit or prescribe this kind of behavior? I know I'm looking at the College of Physicians in BC. It doesn't seem to have any specific rules on this.
No, but I think, remember, there are rules about, there are clinical rules that deal with issues of prescribing. And I'm not suggesting those rules have been broken or not. I'm just saying that we can take actions outside of that. We want to review what's going on. We want to ask the colleges to assess this. As noted, this is not BC doctors in this case. So we believe we have strong support amongst doctors in BC to ensure that Ozempic and other drugs are available for their patients. They're the strongest supporters of measures to ensure that happens. I think what we need to do is to say that the sort of mass exportation of a drug that's in relatively short supply and for which there's demand doesn't make sense. We need to take action to ensure that doesn't continue to happen. We work closely with the drug supplier, and we are not in a position of shortage right now. But again, there's not enough Ozempic in British Columbia to cover up the excess demand in the American market indefinitely. And so we need to take action in the coming period to ensure that protection's put in place. And that I would expect British Columbia doctors to always follow clinical standards and clinical guidelines. Expect they do. I think the evidence is that they do. But that's not what's at issue here. The issue here is that this particular scheme doesn't make sense for people in BC at a time when there's, like I say, huge demand for a drug that has real utility for a whole group of patients.
Daryl Greer, Canadian Press. Daryl? Okay. Moving on to the final question for today.
Oh, hello? Hello? Are you there?
Hi,
Sorry,
Daryl.
I had myself muted.
Hi, Daryl.
I'm wondering, hi there, sorry about that.
No problem.
I'm wondering about the demand being driven by this direct consumer marketing. Isn't there any kind of fear that, this could be a passing fad, that working with the supplier, I don't know how much you've, committed to buying, but like if this is something that you believe to be happening during an ad campaign, what if this drops off when the ad campaign stops?
Well, this isn't the only drug, and this isn't the only circumstances where this might occur. So what we want to do is, when drugs are in short supply, to say that we can't have exports in the thousands to the United States. We can't satisfy demand in the American market with the supply of drugs we have in Canada. So today it's Ozempic, but what you want to do is make regulatory change to make sure that this doesn't happen with other drugs. If what you say or you project as a possibility is the case, this isn't the first drug, and it isn't the last drug that will be coming into the system, thankfully. And so we have to ensure that supply is maintained. And we know what happens in the anxiety it causes, because we've been going through this with children's medication in this period. We know the anxiety it causes when people may not be able to get access to their drug, sometimes even for short periods of time because of distribution issues. We have a very good distribution system in BC, but this is an example. It's Ozempic today. It might be another drug tomorrow, but I don't think this is a short-term thing with this treatment of type 2 diabetes. I don't expect this. This isn't an issue of it being a fad. It's a significant drug, and it's part of our pharmacare system.
Follow up, Daryl.
Is there any possibility in the near future that a generic alternative that could be procured at greater numbers at lesser cost would be available in British Columbia? And as well, these pharmacies that are dispensing them and the doctors that are prescribing them, if they're not breaking any rules, then how is the public supposed to take that?
I think if they agree with me that what's happening cannot be allowed to continue, they'll say change the rules, and that's what we're going to do. I think I forget the first question. I apologize for that. But essentially, I think that's at the core of it. We are going to review, obviously, those rules to see in place. But I think a reasonable person would say this is not what should happen, that drugs be imported into Canada and then diverted to the United States. Prescription drugs, that shouldn't happen in the case of a drug that has significant value and is high demand. We work very closely to ensure that the drug is available here. It's available here now. It's not an issue. But, again, 9% to 15%, 18%, if that were to continue over a period of time, there clearly would be a risk to supply here, and there's no need for it. And so this isn't a suggestion, again, that people are behaving outside of the rules, although that's to be reviewed. What it is a suggestion that this, I don't think this should happen, and so we're taking action to ensure that in future it doesn't happen, whether it's for Ozempic or whether it's for another drug.
Final question comes from Benoit Ferradini, CBC Radio Canada.
Hi, Mr. Question in French for you. Qu'est-ce qui, dans l'enquête sur les prescriptions en janvier et février, quels chiffres sont les plus surprenants pour vous?
Je pense que nous avons eu plusieurs chiffres surprenants. Premièrement, qu'il y avait une augmentation de la pourcentage d'Ozempic qui est envoyé aux États-Unis de 9% à 15% et à 9% de 18% dans les gens qui reçoivent l'Ozempic, premièrement. Deuxièmement, que la quasi-totalité de ces prescriptions venait de quelques, un ou plus de médecins de la province de la Nouvelle-Écosse. Et ce sont deux chiffres importants et je pense qu'il va falloir un changement et j'ai l'intention d'en faire une.
Follow-up, Benoît.
Qu'est-ce qui, dans la loi, va vous permettre d'agir par rapport aux pharmacies en Colombie-Britannique, aux gens qui prescrivent en Nouvelle-Écosse et pour restreindre l'accès aux patients américains? Qu'est-ce qui, dans la loi, va vous permettre de faire ça?
Oui, mais nous avons plusieurs lois. Il va falloir une nouvelle régulation pour limiter, en cas de scarcité, l'envoi d'une drogue particulière à un autre pays. Et ça, c'est le changement dont on a besoin. Il faut absolument nous assurer que les gens en Colombie-Britannique sont protégés. Et je pense qu'il faut protéger la drogue, l'accès à la drogue ici en Colombie-Britannique. Et pour en faire, on peut utiliser des mesures ici en Colombie-Britannique, mais il y a aussi des actions nationales que le ministre de la Santé nationale, M. Duclos, pourrait être en mesure de faire. Et je lui ai envoyé une lettre aujourd'hui pour suggérer des actions qu'ils pouvaient faire aussi.
Merci, thank you.
Thank
And
you,
that
merci
concludes
beaucoup.
today's event.